Founded in the year 1989 and registered with the Corporate Affairs Commission of Nigeria on 15th July 1994, the Islamic Medical Association of Nigeria (Iman) is a professional, independent, charitable, and non-political body that seeks to bring closer all Nigeria Muslim healthcare professionals to render selfless services to humanity with the fear of Allah subhanahu wa ta'ala in mind. The journey for the establishment of Iman was first initiated in Mecca, Saudi Arabia, when some group of Muslim health workers participated in the 1988 Hajj operation. One of the major activities of Iman is to assist the needy patient and coordinate Islamic da'wah activities from within the health sector. In Gombe, the struggle for the realization of the objective of the association has been on, with a set of leaders and their members working toward making the Iman the best professional body to have existed in the state. Muhammad Nasir Ishaq is the state Amir of the state chapter of the association, who was also a founding member of the branch. According to him, since its establishment in Gombe, Iman has been excellent in its activities in Gombe, and the association now operates beyond helping the needy patients, but communities and its members.
And by its manifestos and objectives, Islamic Medical Association of Nigeria collects charity, zakat, wakaf, and some donations for the needy patient. Essentially, the needy patient is their focus. Not only that, but also to bring the entire Muslim health workers under one umbrella to create unity and foster prosperity, including talking to ourselves on character and also commitment to work. When I said Muslim health workers for Iman, it doesn't mean that you have to be a health personnel that before you belong to the member to be a member of the association, so long as you are working in the health sector. So this means drivers, engineers, technicians, and any other person that is working with, including accountants, also are members of the Islamic Medical Association of Nigeria. If you are a Muslim and you are working in the health industry, from the ministry to the facility, you are a member of the Islamic Medical Association of Nigeria. What we do is we serve the needy patient, and when serving the needy patient, we do not bother what is the religious orientation of the person, or what is the background, or what is the background of the person, so long as the person is a needy. During emergencies, for instance, or someone come to the hospital and cannot cater for his hospital bills, we try to get a way to support that patient. So Muslims and non-Muslims are beneficiaries of the interventions of Islamic Medical Association of Nigeria.
Having achieved the 4-point agenda, which includes establishing a medical home, a cooperative, a rapid response team, and continued support for the needy, the state branch of Iman is now set to continue the struggle in shaping the way and manners of Islamic personnel in the health sector, deliver their services to the people.
Yeah, when we came in January 2020, we reviewed all the activities that the former regime were doing, and we saw that we need to improve on what they have been doing. They have tried their best, but we need to improve. So we sat in a workshop, sort of a workshop. We tried to ask ourselves, where are we now, and what is our dream. We try to harmonize all these things, and by the time we harmonize, we saw that we have 4 thematic areas that we need to concentrate on. One of them is we need an emergency ambulance service, that is an RRT, the rapid response team, so that if there is any emergency in any part of the state, or any maybe some epidemics or pandemic or whatever, we can quickly and also simply take our personnel there and see how we can intervene. That is what is expected of an Islamic Medical Association, that emergency response. So we said we must have an ambulance that is fully equipped. We have life-saving equipments, life support equipment, and also oxygen and so many things that are needed in a state-of-the-art ambulance. So we tried to procure that. The other thematic area is also we see how we can improve the services that are being done, that is the needy patients. How can we improve it? This is what I have said earlier on, that we try to strengthen the different unit branches and make sure that they have a formidable leadership. Then the other thematic area, we said, okay, for us as healthcare workers, Muslim healthcare workers, we need to empower ourselves. The only way we can empower ourselves is to create a cooperative society so that people can be making savings. So we created the cooperatives, and it's working. Today, in these 3 years, our achievement in the cooperatives is marvelous. Yeah, so we have 4 thematic areas: the media aspect, the emergency response aspect, and also the empowerment aspect for our members, and also lastly, the needy patient. We need to strengthen how we are supporting the patient. These are the 4 thematic areas, and this is what brought about the cooperative society and the medical home. So we are doing all these things in order to complement the effort of the government and also the effort of the general public to make sure that there is an organization and also there is decorum in the society.
The cooperative society that was flagged off by the association in 2021 has, in the years under review, become a source of succor, rendering a real-time intervention while planning a kind of retirement package for members and the Iman family.
The Iman Cooperative Society was initiated by the last administration, 2017, where they have done much. They created the bylaw to govern the society, but unfortunately they did not take up the society at that time, because of some issues. So in 2020, December precisely, the takeoff of the cooperative society have started. At that time, we started with 75 members only. After that, we put more effort to synthesize our members. We went round to see that our members know about the cooperative society and the benefits. By the year 2021, after 1 year of our existence, then we have about 255 members in the society. So we continue to enlighten members during the annual general meetings and general meetings of facilities in all the units. So we continue to rise up to 302 by this 2022.
While members of Iman now have a pool to run to for support, other communities and the general public have been given an opportunity to test from the association's milk of kindness at the Iman Medical Home, where needy patients pay less for health services.
It assists the community in so many ways. They don't have to go far, and our bills compared to other, even private clinics, government clinics, they are far different, because we charge less. It's just we charge them because we are not manufacturing the items we are like, such as drugs, lab facilities. We have to buy them, so we are charging them very low. So in this way we assist them in getting easier health care services. The facility and services we are offering just rendering of medical care, and such as consulting doctors, scanning, X-ray, ECG, and then sometimes and then we can admit patient for surgery, for other medical examinations.
The provision of a 24-hour rapid response is another intervention that the association thought the society was in their need of, hence purchasing and launching an ambulance service that intervenes in emergencies and other natures of evacuation needs. The rapid response services run within and outside Gombe.
The rapid response, as you can deduce from the meaning, is just like a branch of Iman that deals with things that are actually emergency things. Now, when we came as ESCO members, there was nothing like Iman Arati, so we decided to form one. So the ESCO were able to buy an ambulance car. So basically, what we do, one of the aim is actually to respond to an emergency. For instance, if we are here in special hospital, for instance, then we had a fire outbreak somewhere. What Iman as an Islamic organization, we think we should also give the community something. For instance, free of charge. Not that we just say, okay, it has to be an Iman member. Anybody, of course, even though they are not Iman members, but then we feel we should give them. So if, for instance, God forbid, there is maybe fire outbreak or there is maybe flood or something, we'll carry our ambulance, quickly call our people, carry the ambulance with the equipment inside and go and see if there are patients that need our assistance. Then we can do something there if we can. Then for those that require maybe hospital admission or something, we can quickly evacuate those patients to the hospital. And in that way, by doing that, of course, we are like making the Iman more visible. A lot of people, you ask them in town what is Iman, they will not know. But by the time they see an ambulance with Islamic Medical Association of Nigeria, but the systems are reaching boldly, then they will start knowing that there's something like Iman that exists in the town. So that was actually something that we said, okay, we are going to do it just to give the community something from our own side. The other thing is actually has to do with patient issues. There are patients that sometimes will be referred either from this hospital to maybe Federal Teaching Hospital Gombe, or even from this place or Federal Teaching Hospital Gombe to another hospital in Kano or Abuja or Maiduguri. And then, as I said, usually they are unconscious patients or when their condition is not. So ordinary care will not be sufficient. So you have to carry them. And then the other thing, of course, sometimes somebody will bring a patient to the hospital and then the patient will die. So they need to transport the corpse. Again, corpse too, there's no way you can carry the corpse comfortably within the type of cars we use. So you have to use an ambulance.
With branches across 11 local government areas of the state, Iman has continued to render life-saving intervention to communities and individuals in Gombe State.
Many times we find patients, they will come, they don't have anything. So in this aspect, what are you going to do? So we have to find a way of helping them. And thank God, the Iman has this emergency box, where they keep drugs and then some emergency items that will be utilized for patients, and even money. So we know them, so we contact them, and then we get what we want. And therefore, this will help in the services that we are rendering among most of among our patient obstetric cases. Those that are pregnant, they come with bleeding, eclampsia, so many problems. We had one patient that needed blood, and this blood could not be provided by the relatives. So we had to liaise with Iman and tell them that we have this particular patient, she really needs help. So, and I'm just telling you, there are so many, but this particular one is very touching because Iman has to swing into action. They have a short way of arranging for blood, that I should just send the doctor to go and collect the blood, and immediately the Iman ESCO has already spoken to the person on duty. Incidentally, that time it was one of our Amir of this association in this particular facility, who is also working in the lab. So he just spoke to the person in the lab, and the moment the doctor went, the blood was ready, and we got the blood. We came and gave this woman. The woman was bleeding, so she needed help. We were going for surgery, and that's how we were able to go and salvage the life of that woman. And thank God, I felt this is the contribution of Iman that people will not want to forget.
They used to appreciate us, because I don't think for now there is a kind of association that did so. Almost Iman covers everything, because when they go to the hospital, they now say, okay, where is the office of the Iman? So they now go to the office of the Iman. And then we now listen to their problem. When we find out that they will need an assistant, we now assist. Because there's about 3 episodes that I know that someone come to the hospital with a severe anemia, and there is a need for urgent transfusion, and they have no money to counteract that anemia. So Iman now come in and assist them, bring in the donor, and they donate. They pay all the needful, and later on the patient come back, appreciate the Iman action.
While diversifying and catering to the needs of its members and the society, Iman remains committed to ensuring the development of the health sector and improving the level of services being delivered to the people.
Looking at the community in general, the health literacy is very low. So we want to create a media that will now uplift the health literacy of the entire population. And this is a media platform like some maybe radio programs, podcasts, vodcasts, and so on. We have our channel, a YouTube channel that is there recording our activities and also doing some maybe educational activities for the general public.
Feedback provides organizations with data and perceptions from primary stakeholders about the quality and effectiveness of their efforts. That is an area the Sisters Wing of the association handles.
So the Sisters Wing is another, let me say, just the forum, the side of the sisters. But we work together with the main Iman branch. But I think we have only one activity, whereby it's only the Sisters Forum that conduct that activity. So that activity is Taskar Life Year activities. So the activities was designed, we the sisters came up with these activities, and what we do in the activity is that we help educate the masses concerning how they will promote their health and how they will prevent themselves from disease conditions. Because we see that if the people of the society are being educated on how they will prevent themselves from illnesses, let me say the number of troopings that we have, or the number of people that will be coming to the hospital will reduce.
The Chief Medical Director in charge of the Gombe State Specialist Hospital has this to say.
Well, Iman in Specialist Hospital is a major stakeholder in the sense that it is collaborating with the management of the hospital to add value to what the hospital is doing, as in to provide service to the patients. Particularly if you are talking about the needy patient. If you look at the hospital, it's all about patients. Yes, the government is doing a lot, but there are a lot of patients that are coming to this hospital that needs services, whether drugs, whether investigations, and sometimes surgeries, that are finding it very difficult to access these services because they are poor. Sometimes they cannot even feed themselves. So Iman are there, they are handy. They have what they call drug cupboards, particularly at the accident and emergencies. Another emergency point, so they provide these drugs especially during emergencies. They provide this drug to the patient, sometimes because the patient don't have the money to pay the bills, and sometimes when the patient perhaps not with their relatives at the time of the accident. There are so many patients that you see they will come here, they are brought by Good Samaritan after an accident, and Iman are there on point to support what the hospital is doing in providing holistic service to the patient. And sometimes surgeries, particularly for patients who cannot afford these surgeries, Iman will be there. That's I'm talking about now, paying services for the needy patients. But that is not limited, their function is not limited to patients, but they are doing a lot, particularly to modify the behavior of the health workers. Because most at times, even the health workers assume that they have rights. The government must pay me my salary. the government must do ABCD, must give me my promotion, not forgetting that they have other responsibilities which they have to discharge after signing an oath to work for the government. You know, they have to come in good time, they need to relate well with the patients. Iman have taken it upon themselves to organize a series of lectures that will now modify the health worker attitude, because one of the major challenges when you're talking about delivering quality service to our patients. So Iman are doing well in that regards, in terms of reminding the health workers of their responsibilities. Not only, you know, when you come and you demand your rights, you should equally, you know, remember that you have responsibilities, coming to the work in good time, you know, and also while attending to your work, you shouldn't forget that you are also a servant of God.
This our consulting room. This is where we observe patients. Here is our multi-parameter monitor that records all the patient's vital signs. It shows the blood pressure, respiratory rate, pulse rate, and it also records the ECG as well as the temperature of the patient. So this makes our work easy. Instead of using the manual apparatus, this one you are just seated there and monitoring everything. As soon as you see any change, you should be able to act appropriately. So this is one of the things that actually assist us in our daily activities in monitoring our patients.